What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those that are new to the channel, welcome. My name is Dr. Antonio Webb, an orthopedic spine surgeon. So in this video today, I, along with a couple of my friends who are also doctors, are going to react to our medical school personal statement. So I chose a few of my friends who have been out of medical school for a number of years. It varies from 1 year to 11 years. And we're going to read our personal statement and react to it. Did we write the right things as pre-med students? Or were we just writing things to impress the admissions board or writing things to kind of fluff up our application? I get a lot of questions from students out there that are asking, how do I write a personal statement? And this can be a very daunting task for a lot of people. You know, this is a huge part of your application, especially with everything going on with COVID. Your personal statement has to be up to speed. It has to be very eye-catching, and you're gonna hear from a few of my friends who are doctors as well as my personal statement reaction. Here we go. So I first applied to medical school in 2007. That's 13 years ago. For those who know about my story, they know that I applied to medical school 3 times, and it took me 3 times to get in, even into a post-bac program. So my application, my personal statement, I think I started writing it in maybe 2006. Some people wait until the last minute to write their personal statement. I suggest that you don't do this. You know, it's a continuum of, different sessions where you jot down some ideas the first time, the things that come in your mind. Why do you want to be a doctor? You jot these ideas down. The next time you kind of put these into paragraphs, like an introduction, kind of a main kind of body of your personal statement, and then a conclusion kind of statement, and then you kind of tweak it and work on it as time goes on. So my personal statement, what I tried to do was, I knew that that first sentence, that first paragraph is very essential, just because the admissions committees, they look at thousands of personal statements, and what's going to make your personal statement stand out from another person? So I needed to figure out a way to grab their attention. And once you grab their attention, they will keep reading. Once they're compelled to keep reading, they really, are fascinated by your story, then they will want to meet you. And that's when they invite you for an interview. So this is my personal statement. We're going to go over it here. So I tried to kind of paint this picture. Whenever you're writing your personal statement, you want to paint a picture for the reader. Hey, I was at my grandmother's house and she was dying of cancer, and I held her hand as she took her last breath. That's something that is eye-catching. That's something that will entice people to keep reading. They want to read more of your personal statement. If you just open up your personal statement with some mundane task that you were doing or something that is not very exciting, well, the reader will most likely not read your whole personal statement, and that will impact your chances of getting an interview. So my personal statement, I went to Iraq in 2005. I was a medic in the military. I did 8 years in the military prior to medical school, so that was a huge part of my life, and I wanted to base my personal statement around my military career. So my introduction paragraph was describing this scene in Iraq when we were getting shot at. And I know a lot of you out there are going to be like, man, I don't have a story that crazy, or, I can't match with that. Well, that's what makes medical school competitive. You have people that are former NFL players, people that are former, own their own business, former musicians, former pilots. You got some extraordinary people out there. There's something in your life. You have to find whatever that is to put that into writing, to paint this picture that draws interest to the reader. And if you are the traditional student, you went from high school to college to medical school, there has to be something that you can find. Like, ask yourself, why do I want to become a doctor? And just try to paint that into a picture for the reader. This is 2005 in Iraq, and I painted this picture. The first word that I have in my personal statement is kaboom! Missiles and rocket-propelled grenades are flying in every direction over our makeshift field hospital. Incoming is shouted over the loudspeakers, as it is also announced that 4 wounded soldiers are en route to our field hospital with head trauma and shrapnel injuries. It appeared that we had been attacked by the Iraqi insurgents once again. At that moment, I was in the Sunni Triangle, 20 minutes from Baghdad, Iraq, providing medical care, wearing a 40-pound bulletproof vest, and working in scorching 140-degree weather. Thoughts raced to my head. How did I end up here? Will I make it out alive? Though this brutal exercise seemed to occur daily, we still worked to do what we came here to do despite the constant dangers. We were sent here to accomplish an important mission, to provide medical care for our American troops, Iraqi military personnel, and even Iraqi insurgents. Most importantly, we had to stay alive ourselves. So, even reading this, man, this just brings back a lot of memories of being in Iraq, where a place called Mortarville, where we were shot at multiple times per day, and we got attacked multiple times per day. And just reading this kind of makes my heart beat a little bit, just because everything that we went through when we were there, getting shot at, trying to take care of wounded soldiers. So the rest of my personal statement went on to basically saying staying alive is what I managed to accomplish during my 5-month stay in Iraq. Sadly, not every soldier in my rotation was as fortunate. I did, however, did my part to save as many lives as I could. I went on to say, as a medic in the Air Force, I bore many obligations and responsibilities. Somehow, I still managed to attend weekend and evening classes to continue towards my goal of becoming a physician. In fact, going to war confirmed my choice of career. You have to identify something in your personal statement that just caused that light to go off. Hey, medicine is something that I wanted to do. Was it a death in your family? Was it, something that you saw, a surgery that you witnessed, some shadowing opportunity? Put that into your personal statement. Make it very clear. Being a doctor is what I want to do, and I don't want to do anything else. And they're looking for that confirmation of, that this is exactly what you want to do. I went on to talk about returning to the U.S. I decided to separate from active duty military, went into the reserves, and then applied to medical school. I talked about my last semester of college, entailed 19 hours of coursework, including my research with microencephaly. And then I talked about me being the first person in 2 generations of my family to complete college. And I was really proud of that. So that's kind of my introduction, kind of the first part of my body of my personal statement. And then I went on to my goals as a physician. It's important to list what your goals are. My goal as a physician is to give back to others, to those who are unable to afford health care, to the wounded, to the sick, U.S., overseas, to the people who need it most. I am confident that I already have what it takes to become a competent, caring physician. Further, I believe my experiences, including the 6 years of medical experience that I had up to that point, will prove beneficial to the classmates during my future during my future rotations. So what can you bring to the table? And that's what I was trying to state in that paragraph there. So my last paragraph, coming to understand true diversity, working with people from all over the world, developing leadership skills. These are a few highlights of my 8 years of military experience. Most importantly, I learned firsthand that compassion, effective communication, and listening skills, as well as the willingness to do whatever it takes to meet the patient needs, are attributes of a well-rounded physician. I am confident that I possess all of these abilities, and I wish to expand my scope of practice. Give me the opportunity. I am ready to serve. So that was my personal statement. I was very clear in what I wanted to do, which was become a physician. And, reading this, brings back a lot of memories. I wouldn't change anything if I, had to write my personal statement over again. And, I didn't say I wanted to go out and save the world and, just work for free for the rest of my life. I did say that I wanted to help others who are unable to afford health care, and I do plan to do a lot of mission work in the future. So think it back. I thought, I did a pretty good job at writing this. What do you guys think? Put it in the comments below. We're going to go over to my other friends who are doctors and see what their reactions are about their personal statement. Let's go check them out.
What's up guys, my name is Dr. Jude. I'm an orthopedic surgeon. I went to medical school in Manchester in the UK in 2004, and then I did my residency training in London in the UK, and currently I'm completing a trauma fellowship with some upper extremity surgery at the University of Toronto in Canada. And today I'm going to be going back and reading my personal statement for medical school. Okay, so I went to medical school about 16 years ago now, so I'm sure the personal statement have changed slightly. So at the moment this is 762 words. It's double spaced, and let's read it. So it says, why on earth did you want to study medicine? It's a question I've heard for years, following a gasp of disbelief. Even until today, my reasons have no end. However, it all comes down to my desire to combine my growing passion for science with the chance to work actively with others and have a positive and rewarding effect on lives. I don't know, that sounded a bit corny to me, but hey, it worked. This all stems from my childhood visit to disadvantaged Nigerian hospital. The recent Medlink course at Nottingham University was an extremely eye-opening and inspirational experience. So that was like a 1 or 2 day course where you go and you basically pretend to be a medical student and you get to do some courses and stuff, and that was fun. And so yeah, I put that on there. Shows commitment. It provided me with an invaluable insight to the reality of medicine and the opportunity to discuss issues with medical professionals. As I gained greater knowledge of the different fields, my enthusiasm was fueled, and I was excited to learn of the early student-patient contact in most medical school courses. Yeah, I think it's good to reflect on the course that you're applying for and show that you've done your research and actually why it resonates with you. So I think that's probably what I was getting at. I became assured that I have many valuable assets to bring to the profession. For example, upholding several commitments inside and outside of school has led me to discover that working under pressure often brings out the best of my abilities. So another caveat is I went to medical school in the UK, where you can go to medical school straight from school if you get in. And at the moment, I think it's about 50% of graduates came straight from high school. So let's see. An example of this can be seen in the year I spent as a peer support leader at the Christ Hospital. I did weekly voluntary work in a geriatrics ward at Horsham Hospital. I thoroughly enjoyed my time and was able to learn about what kind of hospital wards, of how that kind of hospital ward operates. And I guess you have to talk about your work experience no matter how big or small, and I always tell people, obviously work experience is mandatory, but how you embellish it, what you say you learned from it, what you drew from it, how it changed you, that's completely open to you and how you write. So I mean, I didn't do the best work experience. I went to a geriatrics ward and I hung out with like some of the people, and we just kind of chilled. Didn't do a great deal, but you got to talk about how it inspired you. I gained great satisfaction from the smiles I raised and the feeling that I made a small difference. So that's what you talk about. You're making a small difference, even though you can't do much because you're not qualified. Anyway, doctors at Medlink and Horsham Hospital have taught me about some particularly difficult cases that they have faced, such as child abuse, dealing with over-demanding and sometimes abusive patients, and cases where treatment is found to be unsuccessful. So it's just good to, I think, reflect on the reality of medicine, and rather than having this fairy tale idea, and know that actually can be tough and it can be emotionally draining as well as physically draining. So I think that's probably what I was getting at there. Learning about these less desirable aspects of the profession, as well as the demands and pressures of medical students and junior doctors, has not diminished my ambition. As someone who has always been goal orientated, I am looking forward to the challenges of my A2 courses, particularly chemistry, which I find most stimulating. So that was just talking about my studies at school at the time and how I was looking forward to smashing it. You gotta be confident. If you're not confident in yourself, why would they be confident in you? That's the way I see it. So it allows me to apply my knowledge of science to environmental issues and practical problems. For example, in a recent unit called What is Medicine, the molecular structure of aspirin was a focus. This spurred me to read articles on the actions of analgesics. Around this time, I was fortunate to be invited to a Young Scientist Day at Novartis Horsham Research Centre, where I worked on the synthesis and structure of paracetamol, Tylenol. A-level chemistry has inspired my determination to use chemistry in a profession that will allow me to expand my knowledge of the sciences and use it actively in my career. My maths and physics A-levels complement each other in many ways. Collectively, they have developed my problem-solving skills and sharpened my ability to understand scientific concepts. Last year, I also studied archaeology, which allowed me to apply a wider range of analytical principles to a range of fascinating topics. So for me, I was just talking about my school studies, I think, and I was drawing on what I've got from it, how it shaped me, and what skills I'm going to be able to leave school with and bring to medical school. And I think, obviously, chemistry, maths, physics, they're huge within the medicine. Medicine isn't really a science, it's more like an art that pulls from each of the sciences. So being able to show that you've got this kind of analytical and kind of background and understanding, it just shows that you're probably going to be able to last through med school. Over recent years, I've taken part in various extracurricular activities. So yeah, obviously, I think your final paragraph or so should be talking about what you're doing outside of school and academics. And I've written here, it's very indicative of who I am. Last year, I was the managing director of a very successful young enterprise company which marketed personalized garments. This was just a small company that my friends of mine at school, we built and we won some awards for. So that was good to put down there. This gave me the chance to develop my leadership and team working qualities, and I passed the final business exam with a distinction. Yeah, that's true. I did an exam and got a qualification. There is no better way to learn the importance of teamwork than through sports. And being a dedicated athlete, I've been a member of several school squads, including rugby, basketball, and soccer, of which I captained for a season. Also, for 3 years, I've been a regular speaker, spectator, or chairman at the school's debating society, which has developed my ability to communicate with precision under pressure. For 2 years, I was also part of the Christ Hospital Human Rights Group, which involved the study of corrupt governments and their treatment of citizens, which led to me writing several letters for Amnesty International. So yeah, this was huge actually at the time when I was in school. And you may feel that being young, you haven't had the time or the worldly experience to put something down, but you can draw on anything. So I was part of the human rights group, and we used to campaign and we used to write letters, and I remember studying really kind of devastating stories, and that really touched me. And so you can put that down, and that will give the reader a flavor of who you are. And so it shows that you're well-rounded. And I've put this range of activities has led me to grow in my character and develop my leadership, teamwork, and communication skills. As a result, I was selected to be a school monitor, so like a prefect at school, which was a prestigious position because I went to a very traditional British school. So that was historical. The school was like 500 years old. So then, you know, you go down in this kind of book of distinguished students, shall we say. I don't know. It is my sincere hope that I will be able to bring with me these personal qualities and excitement for the ever-growing medical field, and in that way contribute myself to medicine. Whew. Now, I wrote this 17 years ago, and today I am realizing my dream. I'm living my dream, and I've worked all over the world. I've trained in London, which for me is the greatest city on the planet, but you know, currently I'm living and working in Toronto. I spent some time in the States when I was in medical school, and I have actually realized all the things that I set out to do. And I think it was through self-belief. I don't know how I had so much belief in myself as a 17-year-old young man. But I knew at that time that's what I wanted to do. And at the moment I'm doing orthopedic surgery, which is really does tie to my background in maths and physics, because you have to use material sciences, biomechanics, mathematics, as well as combine it with some dexterity and some art, and then you have orthopedics. And so that's kind of what my background is in. So I'm unsurprised. You know what? I found the beginning bit a little bit cringy, but you have to put into a little bit of personal context about why you want to get into medicine, and then what you have to contribute. So 17 years later, I think it's okay. This document actually says it was last opened in July of 2004, which is crazy. But yeah, I don't know. There you have it. I think it's kind of corny, but it read well to me. Hey, I hope you enjoyed that.
Guys, my name is Mostafa. I'm a fourth-year anesthesiology resident here at UT Health. I'm one of the chief anesthesiology residents. So today I'm going to be sharing with you my personal statement that I wrote to help me get into med school. This was back in 2012. So I'll break it down. I'll go over the intro and some other parts as well and tell you what to focus on. A trembling earth sent the Lebanese citizens of Berliez into a frantic scatter. However, this was no earthquake. Bombs rained from the sky like a swarm of fireflies, claiming victims indiscriminate of age, race, or religious identity. As I ran in a panic frenzy, a mother's shrills echoed through my ears as she gazed helplessly at her battered son's bleeding arm. Without pause, I summoned a team of strangers to help me lift him to safety, peering behind me as my friend's shadows became silhouettes in the distance. As the mother thanked me, we used makeshift materials from a nearby grocery store to patch up the child's wounds. In this moment of ultimate danger and uncertainty, the sectarian religious differences that tore us apart were non-existent. Rather, we were united by the common humanity that we shared and the tragedy that would ensue if we did not rally to help this child. So background story, this is when I was visiting some of my family in Lebanon back in 2006 and a war broke out, and it completely just changed my view of the world, and it provided me with the impetus to pursue medicine as well. So I wanted to use that as a hook. Looking back at it, it's kind of cheesy, like especially at the beginning, but you know, it's gonna hook the reader, grab their attention, and have them keep reading. So overall, I liked it. Enduring through the war in Lebanon in the summer before starting college is what inspired me to enter the realm of medicine. I saw myself emulating these vivid experiences as a physician. Similarly, I witnessed how these experiences paralleled my own struggles, much like the war ignited tensions between different religious groups. My career goals took a backseat to my daily responsibilities as I unsuccessfully tried to balance academic success while working 2 jobs to try and pay off student loans. Although I'm not proud of my inconsistent academic performance, it was this adversity that cultivated my unwavering determination to become a physician. So when I initially started undergrad, I didn't know if I wanted to become a doctor or not, so I had a couple of bad grades, and I just wanted to address that. You don't have to take, the whole personal statement to address that. You could just take a couple of sentences, address it, and move on. Whereas much attention focused on the chaos that filled in the streets, little light was shed on the systematic problems that exacerbated the ongoing crisis. I saw this firsthand during my time as an intern with the UN, where I would transport refugees from high-risk areas to receive vital medical care. Commonly, all it took was basic access to essential therapies to cure them of their ailments. This irony was fully captured in a moment where I picked up a 12-year-old child who had to be transported due to a lingering bacterial infection, but happily puffed and passed out cigarettes he purchased at the local market. So I remember when I was there, I wanted to get involved and help, and I got involved with the UN. And it was just baffled me that a lot of times I saw kids smoking cigarettes, but they just couldn't get access to antibiotics or any medications that easily. And so I wanted to show the reader that I kind of had a nice scope of medicine and how these social determinants of health really can affect someone's ability to obtain care. So in light of these disparities, I saw innovative ways to contribute to local underserved communities. This has been realized through my participation in the Cultural Cup, which doubles as a free clinic and a food bank. During my time there, I've utilized my thespian background to raise awareness through documentaries and other media, or most recently as a means to raise funds to expand into a mobile clinic. So I talked about my activities a little bit, just touched on them. I told the reader how they affected me and how pushed me towards pursuing a career in medicine. I think that's something you can do. You can break down your personal statement, do an intro, a paragraph or 2 about why you want to do medicine, address anything on your application, and tie in some of your activities. Don't expand on what exactly you did. It doesn't have to be drawn out. Just put a sentence or 2. My path to medicine has been marred with arduous trials, yet graced with heartfelt moments of compassion. Through my time in war, I've learned that the common fabric of humanism is what drives us to do noble things. In extension, my work in the community has shown me that it is the propensity to defer to others and work as a team that signifies a great leader. It's pretty deep. Drawing from these experiences, I aspire to become an astute clinician and pioneer in an effort to realize health equity and eradicate the structural determinants that poison the system and plague the lives of so many. Hope you guys liked it. Feel free to drop by my channel, hit me up on social media. I'm more than happy to help you guys. Good luck on your application cycle.
All right, guys. So I hope you guys enjoyed this reaction video of myself as well as my doctor friends to their medical school personal statements. I hope you guys learned something. The personal statement is a huge part of your application. Start early on it, jot some things down. Just really ask yourself, why do you want to become a doctor? Put it within that 5,000 or a 5,300 word limit, and then constantly go over it, tweak it here and there, work on it every few weeks until you write the personal statement that you desire. Hope you guys learned something. Would you guys like to see this again for residents? Personal statements for various residency programs. Put it in the comments below. But thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.